Okay, the range of motion to be assessed is ankle eversion. The norm is 12 degrees. The fulcrum is over the anterior aspect of ankle midway between the malleoli. The stationary arm is over the anterior midline of the lower leg. The movable arm is over the anterior midline of the second metatarsal. Bring your foot up and out. Okay. Your reading is 20 degrees. For passive ankle eversion, the fulcrum, stationary arm, and movable arm are all the same. I'm going to lift your foot over and up. Does that feel okay?
Yes.
For passive, your reading is 10 degrees. The manual muscle test to be performed is cervical neck flexion with isolated sternocleidomastoid. The muscle to be tested is the sternocleidomastoid, and the nerve innervation is the accessory nerve C2 to C3. This test is currently in gravity minimized, but if you need to palpate, you will palpate over the sternocleidomastoid on the neck. I'm going to have you lay down on your back, please. Yep, and make sure your head is on the table. If you could turn your head to your left shoulder and lift up. I'm going to press right above your hairline, and I'm going to hold the back of your neck. Good. Okay. Now to palpate, I would have her turn her head and lift up, and you can feel right above on her sternocleidomastoid, you can see it.
We are measuring the range of motion of shoulder complex abduction. The norm is 180 degrees. The fulcrum will go on the anterior aspect of the acromion. The stationary arm will be parallel to the sternum, and the moving arm will be on the midline of the anterior aspect of the humerus. The client will be laying supine. If you could lay on your back, please. Initial reading is 5 degrees. And if I could have you raise your arm above your head. And end reading is 190 degrees. So after the initial 5, the overall reading is 185 degrees. And for passive range of motion of shoulder complex abduction, you're going to want to take the client's arm and cradle it and bring it out above their head slowly. Make sure that they're not going through any discomfort. Is this okay?
Yes, it is.
Let me know if there's ever a time when it's uncomfortable for you.
Okay.
And is it okay if I set your arm down on the table?
Yes.
Okay. And is this as far as we can go, you think?
Yep, that's it.
Okay. And the reading is 180 degrees. I'm going to pick your arm back up.
Okay.
going to slowly bring it back down. Let me know if there's any time when it becomes uncomfortable. Alright. The manual muscle test being performed is hip flexion, adduction, and external rotation with knee flexion. It's the sartorius muscle, innervated by femoral nerve L2 through L3. The client will be short sitting with thighs supported and legs over the side of the table. The client will flex, abduct, and externally rotate hip and flex knees. So if I could have you take your foot and slide it up your leg to your knee. And I'm going to apply pressure down and inward if you can resist. Good, that was a 5. You can put your foot back down. For gravity minimizing position, the patient will be supine. If you could lay on your back, please. And they'll take their heel and they will bring it up. You can bring your foot and slide it up your leg to your knee. Okay, very good. And you can bring it back down. Good. And then that would be it. Okay. You're going to bring your hand and put it underneath their calf and your other hand underneath their knee. And you're going to bring their foot up to their knee for them. Let me know if at any point this is difficult for you. And you're going to palpate on their leg right where the sartorius crosses over the femur. Okay. You're going to bring your leg back down.